Welcome to our second panel session exploring digital infrastructure, public-private investment and partnership. The topic of this panel today addresses a foundational challenge in healthcare: building sustainable infrastructure that supports quality healthcare delivery for all. Public-private partnerships and investments play a transformative role in bridging gaps, fostering innovation, and creating resilient healthcare systems across Africa. And today we'll be hearing from a panel of experts who are leading efforts to drive impactful collaborations and build scalable healthcare solutions. So as you listen, I encourage you to engage actively by sharing your thoughts and questions in the Q&A box. And remember, you can view the full profiles of our esteemed panelists on the platform to get more insights into their incredible work. So our moderator for this session today is Dr. Daniela Munene.
Okay, thank you. Thank you for
Give a
starting.
brief introduction of you, and then you can introduce the rest of the panelists and guide the session. So Dr. Daniela is the head of external affairs at Africa Health Business. She's armed with a strong passion for equitable health for all. Dr. Daniela is involved in policy recommendations and idea mobilization in the health sector towards the attainment of universal health coverage. She's a pharmacist professional with over 17 years of experience and skills in strategic planning, business development, policy analysis, and development. Daniela's previous work commitments over the years have focused on quality management systems for health supply chains. So Dr. Daniela also worked as the Chief Executive Officer of the Pharmaceutical Society of Kenya, advisor at World Health Organization, and director at the Kenya Healthcare Federation, among other roles. So Dr. Daniela is going to be moderating this session today. She will introduce the panelists, guide the conversation, and also answer any questions or direct any questions in the chat to the panelists today. So thank you so much, Dr. Daniela, and all the other panelists who have been here today. You can now start your panel session. Thank you.
Thank you very much for starting us off. And a good morning, good afternoon, good evening to all the participants who are logged on to this session. And a very warm welcome to our distinguished panelists that I will call onto the stage to speak to us shortly. But by way of background, let me say that digital health infrastructure is the use of digital technologies, including software and hardware, networking, and sensors to transform healthcare delivery. It encompasses technologies that have become mainstream now in our daily lives, for example, mobile health apps, wearable devices. It also includes system records like electronic health records and the use of telemedicine and telehealth and telepharmacy even. As much as these approaches are transformative, and we know that digital health can radically improve healthcare delivery and accelerate the attainment of universal health coverage goals of equity, quality, access, and affordability, the nexus between regulation, which is needed to safeguard patients' data and safety, and technology development is a delicate balance. The regulation must be enabling, not prohibitory, to development of new transformative technologies. However, in many cases, the development of the technology outpaces the development of regulation. And in many parts of the world, the regulation is obsolete because it doesn't move as fast. But in those cases, can we create a window to still allow innovation of these digital technologies? Now, to unravel the value of digital technology, the role of regulation, the role of partnerships, I would like to call on to the digital stage our panelists. Today, we are going to have the CEO of WellSpot, pharmacist Chima Onyemaobi, speaking to us. Welcome to the platform. We will also have Dr. Uche Chimezi, who is the founder and CEO of Doctorate Healthcare Services. Welcome to the platform. We also have with us Dr. Osa Osueta, who is the Director of Laboratory Medical Services at ISN Medical. And we're going to, yes, thank you. And we're going to be joined by Isa Majub, who is the Head of Healthcare Practices at Blue World. So a warm welcome to you, panelists. Before I start to ask you, a few questions that I have in mind, I would like you to just give in 1 minute a brief about your role in digital health, what your organization does in this area of digital health infrastructure. And this will help to introduce you better to the audience. Maybe I'll start with you, Dr. Osa.
Thank you very much, Daniela. Good afternoon, everyone, my co-panelists. Thank you very much, Fadila. I'm the Director for Laboratory Management Services in ISN. For us, digital health it's almost right now where we are, one of the critical aspects concerning healthcare and what we do as ISN. Our main focus when it comes to digital health, we use the laboratory management systems. So we are able to connect our laboratories, our equipment that we deploy to centers, with healthcare IT. And this shortens the turnaround time for report deliveries when the doctors are reporting, pathologists are reporting. It's we've come to realize, over time, that without the healthcare IT, we are just more or less like scrambling in the dark. Yes, there were some time before, it didn't exist, but right now, we are much better for it, so to speak. So you have laboratories carrying out tests, and the results being transmitted to the doctors immediately, and the doctors are reporting and sending patients to the referring doctors, to the referring physicians, healthcare practitioners, and even to patients, who request for their results as well. So this also shortens the time to diagnosis and care for this patient. So for us, digital health is a big deal.
Thank you. Thank you for that context. I will move to Dr. Uche. Over to you, sir.
Thank you, Dr. Daniela. For me as a person, I have been in digital health space for well over a decade now, almost 15 years. I'm humbled and really privileged to say that we pioneered Nigeria's first electronic medical record system, circa 2011, 2012. We provided leadership for the team that built the all-purpose medical information system. And since then, I've not gone back. It's about 3-4 years. Also pioneered tele-ECG reporting. A simple study I was involved with revealed that most people, men particularly, all right, were dying of cardiac arrest in Nigeria. All right, so that led us to partner with Tricog is in India, and GE. So we set up with the GE Max 600 and local cardiologists in town in Nigeria, which resulted to setting up a system that saw us train every person in any healthcare facility that is involved with documentation, from nurses to even lab technicians, how to put the electrodes and then hit the buttons. It hits Tricog's dashboard, their sitting cardiologist report, and comes back to us. And in 15 minutes, this report gets to Nigeria. And you don't want to imagine countless people, that were saved through that process. At the moment, I'm building doctoral healthcare, and we are saying, hey, wherever you are, anywhere in the world, you can take care of your elderly ones. Your senior citizens can be taken care of. And as sponsor of that package, you can also follow their treatment. You don't have to rely on phone calls from someone who doesn't understand the care, who will just tell you, we've gone to the hospital and doctors said they will need to do something. And you're wondering in your head, what are they going to? She says, I don't know. But hey, imagine you're in Kenya and imagine you're in the US and your relatives, your dad, the mom is in Kenya, and you can actually see the records, right, on the system, right, have access to it because you paid and you really said you would like to follow the system. So that's what we're doing. And we are covering both rural and urban areas, and our on-site healthcare practitioners can actually do their documentation, and it hits the cloud. All right. I so believe in it, and I believe strongly that aside improving access to healthcare, I believe the outcome will really, really improve. I was with Dr. Saz on his project in our last place. It was also some healthcare. It was us looking at how we can use health management system and ensure access to care is really, really democratized, so that everyone, wherever you are in Nigeria or anywhere in Africa, you should be able to access care. So I think it's a no-brainer. I think this conversation is right. I'm hoping that after this conference, we begin to implement everything. I've attended virtually all the sessions, and I see everyone is in unison. All right, our thoughts and our statements are aligning. So I'm hoping that RegTech will pull up a very formidable statement and ensure that this is implemented. Thank you.
Thank you very much, Uche. That's some good background for us to put in context as you give your submissions. Chima, if you can hear us, please introduce what WellSpot does in the digital health space.
Okay, so can you hear me?
Yes, loud and clear.
Good afternoon, everyone. Yeah, so I'll talk a bit about my background and how I got to WellSpot. So before now, I've been in traditional industry, worked in NAFDAC, worked in Johnson & Johnson, worked in Promasido. And the part I played was the regular commercial roles. However, I've had to do on the side passion project. In 2018, 2019, I worked on an EHR project, but at the consumer end, where you own your EHR, then you give access to whoever doctor you're consulting. Then I think in 2020 I worked on a telemedicine platform. It was a global platform where they were leveraging cryptocurrency to access specialists from all over the world. But it was a passion project, short while. Then I think the first time I was given the opportunity was when I stepped into Drugstock, and I was doing a lot, doing a lot of change management and innovating around healthcare businesses, simply put, pharmacies and clinics. And I think it was from there I got my eureka moment that, okay, I think the most sustainable health system is actually a community pharmacy. And at that point, if you have an innovative mind, like I've always had, and that's why those things were my passion project. If you have an innovative mind in a community pharmacy, you will leverage a lot of opportunities, recruitment for CRO, introducing digital, consumer tech. And that's why I started this. And, I've started piloting some of the things I'm doing, hoping they will come on board next month. So next 2 months, January 2025. So right now in WellSpot, trying to all the things I've gotten, trying to introduce some of this technology to the residents. So that's what I'm doing at the moment.
Thank you so much for that context. Now, I don't know if we have been joined. Yes, thank you. By Izhar, but I do see Faidat Abdullahi. Might you be here to represent Izhar Majub? I do see a fourth panelist.
Faidat she's not amongst, she's the host.
Oh, she's the host. Okay, so I think that is maybe still on his way. So I'll just get started because we want to get as many insights as possible from our experts. So I'll start with you, Osa. I'd like to hear how PPPs in digital healthcare can be designed to prioritize patient outcomes and healthcare access, particularly for underserved populations, to achieve equity.
Okay, thanks very much, Daniela. Okay, so one of the things I've realized, in PPPs that are really critical is that the approach, to any PPP, be it healthcare IT, be it diagnostics, whatever, right? It's got to integrate certain parts. It's a multifaceted approach. So some of the critical elements that must be there, it must be patient-centric. Patients are the core, they are the core. They're the reason why the PPP exists anyway. So it's got to be patient-centric. Then it must be equity-focused. You're looking at the public, you're looking at the private. Each party has to bring in their own form of equity. You must have equity strategies where both parties are beneficiaries, regardless of what each person is bringing in. And a critical aspect to this is it must have long-term sustainability. So you are not starting a PPP initiative or project for just 1 year or 2 years. You want to see this extend beyond 5-10 years, and of course the parts of continuous improvement, because you start at point A and you're gradually building up, to get to the final point, and continuous improvement, where you are. Then there must be a very, very clear and mutually agreed upon vision between the public and private entities. Now, it's like I said initially, that it must be patient-centric. So what are we looking for? Improving patient outcomes, enhancing access, and reducing the health disparities. That's what the focus is on, right? And so we are not looking at the underserved populations. These populations include the rural, low-income communities, marginalized groups. And then, of course, now then you are bringing in digital health initiatives, right? These initiatives should be designed. They should be able to meet the needs, the unique needs of each underserved population. So if you're looking at the rural areas, what are the critical aspects of health that need to be put in focus, that everybody has to agree that we are tackling this, so to speak. Looking at the elderly, they are not digitally savvy. So what are we going to do, to make it seamless for them, to give them the access that they need? And then again, I always say something about health. If it's public-private partnership, if it's the public, if it's private, whichever way we are going, right? The health, now focusing on digital infrastructure, needs to be within the 3 A's. I call them the 3 A's. It must be affordable, it must be available, and must be accessible. These 3 A's are so critical, especially when you're looking at underserved populations. So now we are bringing the public and we're bringing the private sector in. How can we make it equitable? So public sector, what is in their hands? Policies, subsidies, right? They can bring together the private sector. Private sector plays a bigger role, so to speak. And you'll be looking at it from the angle of their own efficiency, their own knowledge of how to access what is needed, the infrastructure that is needed, how to build something that is not so expensive. Yes, any business that is being built, right, needs to more or less be profitable. But then you're not looking at profit at the expense of everyone suffering. When we access the digital health, what you're looking at is everybody benefiting from it. Then we need to also look at the cultural approaches. Each center, each area, no matter where we are, is different. Each area has its own cultural sensitivities. How do we approach those? Then the linguistics. Right now, this is Africa. Africa is a multilingual society. So the digital health has to linguistically appeal to the communities that you are going to. To the elderly, it has to appeal to them. They've got to see it as it's ours. They can't see it as it is theirs, or they've just brought something for us to use. It's got to be seen as ours. So it's got to meet them at their points as well. Then we now come into capacity building and education. Digital literacy is not as widespread as we think. Most of us live in the cities. So it's so easy for us to assume that, everybody is IT savvy. We all have smartphones. But no, even healthcare workers, in the areas, again, rural, low-income communities, they are not as digitally savvy as we think. So digital literacy is another very critical and important part. When we are talking about the public-private partnership, public and private organizations, right, working together to partner digital health. Thank you.
Okay, it's interesting that you've talked about being patient centered. How can we know that our initiatives are patient centered?
Sorry, I lost you there. You said being patient centered. How can?
Yes. How can we measure? What would be the key performance indicators for a PPP project in digital health to show that the PPP is remaining patient centered?
Okay, so let me take this back and say I like to call it key success factors, right? For me, key success factors is you're looking at health improvement, the health services that are being delivered, right? Like I said initially, continuous improvement in quality and continuous improvement in equity, that's being delivered to the patient. Now, if it's patient-centered, you don't want your patient saying there was no benefit to plugging into the digital space. That's not what you want. You want your patients, to come back and say that it's just fantastic. You want them to be happy, right? Health sometimes, as for all of us in the healthcare space, we know that sometimes it's not necessarily the drugs, so to speak, that treats the patient, right? There's still the other steps of it. The patient is happy, the patient is open to using what you are more or less like breaking down for the patient. So if you are putting digital health in front of the patient has got to be able to see continuous improvements in health. The patient has also got to see that I can access what I'm being given, easily. Then, of course, patient engagement, satisfaction, you are looking at every single thing, all playing together to ensure that it works. Then your healthcare service, the healthcare delivery service providers, so to speak, even they as well need to be satisfied. They as well need to be happy, within that digital space that's been provided. And they are happy, they're getting it right. They're also able to translate this, to the service they deliver to the patients.
Yeah. So I would even suggest that we need to incorporate a way not to only get the feedback of the health system managers, but get the feedback of the patients who are the beneficiaries, design some feedback, some surveys, because sometimes we just talk to ourselves as the managers and policymakers. Yeah.
Exactly.
Yeah. Thank you for that submission. Let me move to you, Chima. From your perspective, how can governments and private companies ensure equitable access? OSA has really emphasized on equity, but how can, sometimes private is there for a commercial benefit, whether in the short term or the long term, but government's job is to make sure that health services reach everybody. So in this partnership, how do we make sure that there's equitable access to this digital healthcare technologies?
Sorry, is that?
That's for Chima.
Oh, sorry, I had them in network glitch. So yeah, for such condition, I mean, that's some of the things I also partook in my work with Drugstock. So I mean, the job of government is providing enabling environment, and it could be in terms of infrastructure, investment, or in the part of regulation. And I think for digital health, I'll give you an example. We all know how the Ministry of Works, how it functions, where they say they will give tax relief if you build the road for Apapa. We'll give you tax relief if you build Enugu Owerri Road. And those are some of the things that they may make for digital health investments, where they are given relaxation based on tax relief for for the low-hanging fruit, where there's this platform for using short SMS, like as we said here, for our elderly ones, they are averse to not averse, they are not used to using technology, but they are comfortable a bit with things like short SMS. So imagine they can use short SMS, and the MTN or whatever network provider gets a relief for it. So it boils down on regulatory from the government side. They look at where they can win low-hanging fruits and offer some sort of relaxation for the companies getting involved. And of course, another part where they can do this is orientation program. I'll say educational program. So the educational programs will be more on the part of awareness. I mean, we have the agencies, I think national orientation agencies, and government has media assets, a lot of leverages when it comes to information. So they can use such to disseminate their radio stations, disseminate information across, those channels on how, people can leverage this technology, and that way they are penetrating everywhere, and everybody knows how in the rural area. Like, let me give you fun. Even in Lagos here, the northerners that reside here, trust me, they are glued to their glued to their radio, BBC Hausa. Imagine Nigeria leveraging that to provide information and raise awareness on things they can enjoy on their low-hanging fruit, which is their SMS that they are using already. That way you begin to create access for this digital technology. And I think the third one should be the infrastructure. Now, when I mean infrastructure, I mean we cannot talk about digital health without talking about electricity. So electricity, and when they did Band A, we saw how some hospital MDs were complaining they were paying about 4 million. Even teaching hospitals had about 14 million to pay. And those are the things that can actually, hinder the growth of, the access of digital technologies, digital health technology. And those are things that government should address, such that they intervene and give special attention to those things. And you can bear me witness that even the proliferation of, medicines and pharma manufacturers and market authorization holders and importers, where the things that NAFDAC did, that, okay, we are creating an inclusive environment. You don't have to fake drugs. Just register and let us know the factory you're registering. And that way we have, affordable medicines, and, we have options, and they can start to mimic the success in other places for the private industry. And trust me, if they do such things, a lot of people will start investing in digital. I'm talking about something to stimulate, individuals to now go into private businesses, private digital health businesses, and it will be a catalyst for that industry, because government has done that has provided that enabling environment. I think that's all I have to say to this.
Yeah, thank you. In fact, you've answered the second question I was going to ask about how to address the rural areas. And I think you've put it very well, that if government lays down the enabling environment of electricity connectivity, the private sector, innovators and entrepreneurs will go and invest in those places. So that's very clear. So let me jump to, yes, you wanted to add something, Chima?
Yeah, so I want to add something, because this thing is not only particular to workforce. Most, even in the US, you'll be shocked that most doctors that in the New York part, Maryland, and in Nigeria, so to speak, if you check the ratio of patients to doctors in Zamfara, you'll be amazed. So for rural areas, the lifeline we have there are allied health workforce, and there's no need to fight them. Currently, I think some stakeholders are already even intervening with PCN to allow some sort of satellite pharmacies in rural area, and allow pharmacy assistants to man those things, maybe with the aid of digital technology, where they can now seek second opinion with the pharmacist and still, titrate upwards to a GP. So for rural area, the first thing we have to agree with is to welcome every College of Health graduate, every nurse, every public health, BSc graduate, and embrace them and actually look for ways to increase their digital literacy. Now, the second thing is, I think there is opportunity in digital health entrepreneurship, like what Dr. Red is doing. So, I mean, I was shocked in pharmacy in school when I discovered they were not teaching entrepreneurship and development to the medical students. I'm like, why shouldn't they teach entrepreneurship to doctors? I mean, we've even gone ahead to have digital health, which is a pretty new area in the world. I think it's not more than 20 years. It started with mobile health. Now it's called digital health. I think generally, the Minister of Health, everybody should be looking at how to put it in the curriculum, standardize it, put it in curriculum, so that as a pharmacist in your curriculum, you're studying a part of digital health as a doctor. And I think those things will serve as a stimulant for the ideas one person can bring in. And I think that way, people will be conscious of how they can reach the undeserved and people in remote areas. I think that's the thing I have to add to rural areas, the inequalities.
Yeah.
There.
It's an interesting point you've raised about using the allied health professionals. And when you combine the allied health professionals with the digital technology that can allow them even to consult a higher professional remotely, then the patient still gets care. So allow me to yes, but allow me to still stay with you, Chima, because I know you're a pharmacist. I'm a pharmacist as well by training. Some people on this call are medical doctors. So while in theory, okay, conceptually, that can improve access, and so two issues come into play. One is the willingness of the regulators, like the health councils, to allow these these allied professionals, to do an expanded set of service. Number two is also the unwillingness of the professionals themselves, because they have their professional associations and they're very strong in influencing regulation. So this actually brings me to the core of this conference. Is there a tension between the regulation and what is needed for the patient? Are we professionals and, are professionals standing in the way? Are regulators willing to safely task shift and allow the allied health professionals to provide care? How do we strike that balance? Because I know from the professional perspective, professionals like to claim that, the patient will be at risk, even if they don't want to practice in the rural areas, but they don't want people in the rural areas to be served, by a lower cadre. Please, your comment on that. How to resolve that tension?
Okay, I mean, I can tell you what the tension is today is not what the tension is was yesterday or last year. So the tension exists, but I can stand here and tell you how even prescribing guidelines all over the world, they are reviewing it, that pharmacists can take up some. I mean, as I mentioned earlier when I was introducing myself, that I discovered the best way to innovate at the core of the consumer health technologies, even at the community pharmacy, because they are a bit everywhere and it's the most sustainable health system. So I can tell you that with that advantage they have, it's obvious to everybody, and they're beginning to now expand their services. I mean, the doctors are now giving us go ahead to do some things like vaccination. So I feel with time, the brain drain. Some of us say we should have read nursing or doctor, sure, we would have been on our way to UK or Dubai. And it's obvious. So the more that happens, the more everybody will address the elephant in the room. So I think it's a matter of time.
Yes.
The tension is there, but more there's pressure on the health system where someone has a hospital, but the children that are doctors don't want to stay in the country and they are leaving.
Yes.
He would look for the next option. That man might be influential, might be a key opinion leader in that year association. And that's what he will bring up there. And as he's bringing it up, there's a tipping effect because everybody is now saying, oh, we need to address these
Yeah.
things. And I think it's time. The tension will douse with time to address this issue. So we should just give it time.
Yes, I think we should, and we should open up a lot more dialogue, because I've also observed
Exactly.
Chima, a phenomenon where a certain cadre, for example, the pharmacists, they do studies and they prove that now they can provide an expanded set of services, and that's fine. So then the medical consultants, they are in agreement. But when also we are called upon to allow maybe the pharmacy technicians to do some more, and then we become more, the task shifting ends with us. We don't want to shift it downwards. So this is something I believe that needs dialogue continuously across many cadres. Wow, that's an interesting one.
Right.
So let me quickly move to Dr. Uche, if you're still with us. Somehow the screen is not allowing me to see everybody. But Dr. Uche, I believe you're there.
Yes.
Okay, great. How can PPPs help reduce the cost, of digital healthcare infrastructure, such as telemedicine platforms, electronic health records, and data storage solutions? Because especially laying out infrastructure nationwide tends to be so expensive. And even sometimes investors also are worried about when they'll get their return on investment. But how can public-private partnership help to address this cost? Thank you. Over to you.
Thank you so much. Interestingly, I've been at, I would say I've been at the core of some PPP projects in the country the past, since 2020. Yep. So 2019, myself and a few friends were able to develop something we called medical collaboration services. Thought it was going to be innovative to help in deploying certain PPP projects, especially in Southeast Nigeria. And the challenges were over there, But again, we realized that, look, this can work. All right. So a few of the things, in a few of the things we shared with the government, all right, during engagement, we said, hey, okay, it was easy to tell them, don't bring any money, government jobs on it. And then you implement, and they tell you they have 600 people who want to fit in for job openings for like 20, 25 people. And you're like, hey, this is not possible. All right. And then when you tell them, okay, you know what, let's share this risk. You bring in 30% and I bring 70%, it's still a challenge.
Yeah.
Right? But again, I still made it known to them that, hey, this is what you need to do. At the moment, we're engaging with the government in South Nigeria. They have luckily implemented health insurance statewide, but enrollees are even signing out. They're backing out because they moved from primary healthcare facilities where there is almost nothing to a government general hospital where they are supposed to at least get an ultrasound scan done and ECG done. There's also nothing. So we say, you know what, let's provide diagnostic equipment for you, and then we share revenue. All right. But tell government, you know what, you're supposed to spend 100% of this. Why don't we do cost sharing? All right.
Yeah.
So it's 50-50. Let's do 80-20. From the private sector, we'll go source the funds and bring 80% of the funds, and then you do 20%. All right. So I think that cost sharing through capital investment is one. All right. It could help, drag costs down on the part of government. And for government, again, I see government leveraging on private expertise and technology. For example, yes, we said we are going to do medical diagnostic equipment, but hey, we are bringing healthcare management system along. So we're saying you will not be able to mine true data, quality data. All right. Our solution is not only health management system, we're also bringing telehealth solutions. So you can have a professional in faraway Kenya who can see a patient in Isialanga local government in Nigeria State. All right.
Yes.
And a whole lot. So we tell them, hey, you don't even need to pay for this service, all bundled. All right. So I think that's another way. So instead of government to go hire a digital health consultant that will pay 6 figures and above, it's coming. It's our own contribution to ensuring that this system works. All right.
Yes.
And hey, there's
Yeah.
also economies of scale. All right. So we can deploy digital infrastructure at scale. We can deploy our HMS at statewide. So
Yeah.
it's not located, it's not in a facility per se. All right. Government
Yeah.
will now be able to pull data and be able to do proper budgeting for healthcare initiatives or healthcare spend. All right.
Yeah.
So
Yeah.
I mean, all right. And above all, hey, risk sharing. We are telling government bring 40%. We believe this will work. All right.
Yeah.
So government is only taking 40% of our funding, out of which they would actually have done the 100% and maybe fail
Yeah.
flat. All right. And if they fail, they lose a whole 100%. All right. Another
Yeah.
thing again. So I give you this interesting example. So I know a state governor who went to a bank to seek funding for funding to get equipment that, and some medical devices. The bank refused.
Yeah.
All right. I mean, many of them, and I'm sure that's how it is in Kenya. Many of these politicians pick up funds and don't repay. All right.
Yeah.
Just
Yeah.
ends up that way. All right. Interestingly, it was at the same time we're pitching to this governor, and guess what? We're getting funding from that same bank to do that project. So if government, if on the public side they allow this kind of conversation, kind of engagement, it improves the access of funding. So now
Yeah.
they needed funding to do a particular healthcare project. They can't secure it because of bad reputation. But we are coming private sector. We don't have such reputation. We've got good reputation with the bank. Bank is giving us the money. We are deploying the digital health infrastructure in your state. So you see how this works. So funding has eventually come for that. And of course, we don't only promise them what will work now. We are saying, hey, operational efficiency over a long period of time. All right. So
Yeah.
this will work. All right. This is not, of course, we know we are committed to this. We've put in 70-80% of our funding to this. We want it to work. We are from the private sector. All right.
Yeah.
We don't
Yeah.
only do impact. We also want to see revenue coming.
Yeah.
Then
Yeah.
lastly, hey, this is sweet revenue generating model for government. So government can actually generate revenue because we tell them, hey, aside you bring in 30%, because we know you own these patients literally, in quote, every investigation that passes through the system will make sure a certain percentage goes to government, a certain
Yeah.
percentage back to us. Another percentage manages the whole system, as it were, because we're bringing medical equipment, we're looking at extended warranty, we are doing insurance, we're also adding biomedical services to it as value add, which
Yeah.
many times if it was government, they may not look at these things. So you see them buying the same equipment every year in, year out, they're buying ultrasound, and a whole lot. All right. So government also gets revenue from the little they have injected. So I think this will help reduce the cost of digital infrastructure on the part of government. Thank you.
Yeah. Yeah. Thank you. Thank you. I think it's clear, co-funding by both partners. And I think you mentioned something about a model where, people can pay per each instance of use over a long
Yeah.
time.
Yeah.
Yeah.
So are you suggesting that in such a model, it's, the patient paying, the actual patient paying for using the service can be built into the money that they invest, the investor needs to be paid?
Yeah. Yeah.
Okay. I want you to
Efficiency.
about the models that can make it easy to afford this in the long term. Yeah, over to you.
Okay, like we're doing at Doctorate Healthcare, I'm happy Chima listen to my presentation and make examples from it. So we're saying, hey, you can pay subscription, you
Yeah.
can do subscription and enjoy 100% of care. All right, you can even pay per use.
Yeah.
All right, so every time you come to the facility and use it, you can pay 1,000, 2,000, and also the much touted health insurance scheme that is not working can now work. I give you a
Yeah.
simple example. I'm a young man with government civil service. I come back home one evening. I come up with chest pain. I walk to the primary health care center.
Yeah.
From there, they tell me go to the general hospital. If I go there and I get an ECG done over 2, 3 times, trust me, I'll tell my brother, I'll tell every other person I know this is working, and it will encourage more enrollees coming. But if I make 2 trips to the general hospital and I have to do out of pocket in
Yeah.
town to maybe 10K, 15K to get ECG done, I will go tell everyone it's not working. So I'll go
Yeah.
off the system, two other people go off the system. So the government loses eventually. All
Mm.
right. So health insurance can now work. All right. And of course, it will also, this is what I tell them, that this will open them to more donor fundings and more grants coming. Because, hey, the Bill and Melinda Gates want actual data. They don't want assumed data. And this
Mhm.
is, there's data management system where you can pull data easy and then you're able to talk to them and you get such funding. All
Yeah.
right. And of course, I give you an example. The microfinance bank is talking to us, Dr. Healthcare. All right. They want to try and offer payment services. And I said, hey, because we are bringing customers to you, what are you going to give us? So it becomes win-win for everyone.
Yeah.
All right. So banks that what the government fail to understand that the banks they are running to can actually run to them. Because,
Yes.
hey, if you prove that you have 20,000 enrollees for your state health insurance scheme, that's another 20,000 potential clients for the bank. All
Yeah.
right. All you need to do is just add a simple payment system and they come rushing for you.
Yeah.
All right. And another thing, hey, government can actually lease this equipment. So the last corporate job as well that I did was for a healthcare financing organization, and we thought of doing placements, medical equipment placements at facilities, private hospitals, government-owned facilities. You know, guess what? Many of them don't even have a simple business plan. So they can't even tell you how many ultrasound that can be done in a day. It may shock you to know that many of them don't even know how many patients come to your hospital the previous day. No
Yeah.
data. All right. Now with us coming on board, we say, hey, you can help put structure, and some bit of system into your business. All right,
Yeah.
and you can actually lease. You can pay, rental leases equipment and rent them. And of course, I've talked about insurance and bundle. So there can actually even be health check plans because you now have this system. You have an ECG, you have an ultrasound scan, you have a good CT. You can actually sell health check plans that is not health insurance covered. All right.
Yeah.
Some people can actually say, look, they want to do, there's a way we call Nigeria, I want to do body test, the whole body test, so you can actually call them progressive. So I got Dr. Saz there, and you can sell comprehensive health because if you don't do it well for them, trust me, they'll go and meet the other guy in town who will just tell them nonsense and pick their money, and then they say, look, the healthcare system is messed up. All
Yeah.
right. So,
Yeah.
and a whole lot. There could be shared ownership, cooperative models. I mean, this list is endless. I'm
Yeah.
hoping that this recording will get to them, and then they reach out to RegTech and call a few of us who have been privileged to work dirty, as you, if you allow me to use that word, to come help put systems, put right this to come help ensure that this system works. A healthcare can be fixed. It's not damaged. Thank you.
Mhm. It's not rocket science.
It's not.
Okay. Let me circle back to you, Osa, on the same topic of funding. How can public and private entities collaboratively fund large-scale digital infrastructure projects? For example, nationwide electronic health record systems?
Like, riding off what Dr. Uche has said, it's a two-way thing, the public, the private sector. One thing that I've realized as well, in my whole course of this PPP is both parties have to be flexible. It can never be a one size fits all. Some centers, when you're looking at working collaboratively, right, public and private, in all honesty, there are some centers that are smack in the middle of nowhere. Yes. Patients do not come there, then just a few kilometers away, that other center is so packed with patients, right? So where I'm going with this is saying that center that has nobody, why insist, on putting all the medical equipment and devices there? Move to the center that has the throughput. Let us start from there. So there's got to be flexibility. There should be innovative financing, right? Different models that fit each one. Nothing again is set in stone, right? And a critical thing, for private sector is that risk and reward must be shared. I will not take all the risk and you enjoy the rewards. Oh, no. Risk and reward must be shared. Government, yes, agreed, you are bringing the premises, agreed, you are bringing the personnel. But you see, there are some other little risks that exist. And when you look at these other risks, things like the doctors, how are you going to speak with your physicians? How are you going to speak with the healthcare providers, telling them that, look, this is a partnership. There's got to be accountability. There's got to be stakeholder management. There's got to be transparency. Transparency is critical. I need to trust you. You need to trust me. Then, bringing the whole thing together, now giving it a face, right, improves the whole system. So you start from everything should be broken down in phases. You can't just say we are going to put digital health in a state, right? And there's no plan. We are rolling out January to end in December. Yes, that is the plan. However, it should be taken in phases, right? Now, you do phase one, you are seeing the returns on your phase one. Then everybody is now emboldened to move on to phase two, right? And, government, again, they can give improved on their policies. There are grants that government gives. I was at a conference, right, where there was someone, I've forgotten who he is, came and said that, do you know that there are government parastatals that actually have funds set aside for certain kinds of projects? I was shocked because, most times we all think that Ministry of Health handles everything, Ministry of Education handles everything. But there are certain government parastatals, right? Like the MDAs that are attached, like a healthcare, the IT part of certain MDAs that have maybe a 5%, 1%, of revenue being dedicated to healthcare IT, to digital health infrastructure. But they're just sitting there, and government knows that those funds are there. Bring them out. Tell the private sector, we have these funds. How can we work together? How can we, roll out as partners? That's what we're looking at. How can we roll out as partners? Then there must be a willingness on both sides to make sure this digital infrastructure is robust. Yeah. It cannot be a one-sided thing. It's got to be robust. It's got to make everybody happy, so to speak, right? Stakeholder engagement is essential to maintaining a patient-centered digital infrastructure, right? Governance. We must all be accountable. We must all be accountable. There's no hiding in between, the books, when the account officers, the auditors, when they come around, there's no hiding. We must be accountable. when both parties, agree on certain levels, it's smooth and it runs easily, So yeah, I feel that it's just got to be collaborative, where government and of course, we all have the federal and the state. Federal says A, then the states I want B, so that whole thing of working together collaboratively, federal, how have you communicated what you want delivered to states? You understand? Then the states, filters it down and then bring in private sector. What's in my own experience, what I've realized over time is that the state plays better with private sector. They know where they want to go to. They understand where they are going. So they play better with private sector. Federal, right? If federal can just roll out the right policies that will support the states and private sector as a whole, then the states can take those policies, whittle it down to fit their own policies, state policies, so to speak, when they bring in private sector. Thank you.
Thank you. Thank you for those insights. What's coming to mind as you've answered, and also as Dr. Uche answered, is we can also learn from other PPPs in other sectors, because, like, for example, in the civil infrastructure sector, PPPs for roads, for example, where the private developer develops the road and collects a toll, for years. It could be 20 years, it could be 30 years, for example, for an express highway. That's something that we find is commonplace. It's not rocket science, but somehow with digital health infrastructure, we approach it with a lot of angst, and it seems very unknown. But I think if we simplify it in our heads, we can find solutions for long-term payment. And I like also that you've brought up sometimes the tension that happens between state and federal. Some states sometimes feeling there's overreach. So it also tells me that the partnership in a PPP, for example, for digital health infrastructure, the public, we're saying it's a partnership between public and private, but the public part itself also needs to have collaboration. It needs to have partnership with itself.
Yes.
Yes. Wow. Let me move to Chima. I want now to talk about aligning with national and regional strategies. How can PPPs in digital healthcare align with broader national and regional healthcare strategies? For example, the Africa Union's digital health strategy. And how can such alignment help ensure consistency and scalability across the continent?
You can hear me. Can you all hear me? All right, thank you. So Dr. Osa touched, on the point on collaboration between states and national, like state government and federal government, like there has to be partnership. Now, I just want to state that, the goal of that is to actually drive inclusion. And when you look at
one minute, I think your earphones are bringing some feedback. You were more clear the last time. Yeah. Oh, that's okay. Mm-hmm.
Okay, can you hear me now? Maybe I'll just hold the earpiece. Okay. All right, sorry. Yeah, so I was going to, I said earlier that Dr. Osa touched on the point that federal government and state government, they need to find how to work together. So if you look at what digital health is, it's about driving inclusion. I mean, I always sit and just think about what the fintechs have achieved, and always wish that upon digital health, like we need to achieve the feats that fintech has achieved, where they've driven inclusion for all And if you look at, they are one of the industries that cooperate the most. You'll be shocked that InterSwitch is serving Visa, Visa is serving InterSwitch, serving MoneyPoint. They always serve themselves, and those are some of the things that we should learn to adopt in digital health. Like, we should be open, transparent, and trust each other. And I think that trust should start from the private companies, because when we have that high level of trust, it can begin to reflect even in the way we work with public. Now, as I said, that digital health is about driving inclusion. Now, if you look at what tech is, generally, tech is to provide access, access and ease, affordability too. So if you now inculcate all those things, and there's a broader level of conversation, the goal would be to standardize information, because that's what digital health is. Digital health is about. It's about standardizing information. So we need to trickle down policies. They need to be more conversation. So if there's so that any entity trying to set up a company is already understanding the need for data governance, data privacy, also the necessary information they need, how to anonymize data, and how to communicate with the next person. So once that is trickled down from top, we will know the basic information we need for an elderly patient, a baby coming in, and that information find a way to communicate with the next private company. And I think when we begin to do that, we create a web of needful information, and those needful information will feed into public health strategy, some epidemiological interventions based on contact tracing, and addressing some pandemic or epidemic. And once we have those kind of information, once we have those kind of assets, that is when we can now look at what the regional strategy is. And trust me, it's important, because we are talking about African continental trade, and it means more movement of people, more trade, more businesses across countries. And what that will mean is you might need to roam with your HMO and the rest. And if we've not done these things around standardizing the information, democratizing even access to your EMR, such that you can share with partner hospitals or wherever you're supposed to see when you're not in your country. If we don't have those conversations, you will see that we will not even have what the region West Africa can serve to the African Union in terms of planning, because the goal of all the information we get from digital health is for planning. So first of all, I think from the African digital strategy, the goals are simple. They need a particular number of workforce for digital health practitioners. They need this kind of information for tracing maybe pandemic and epidemic, or for planning for the high risk individuals for a certain disease class. Those information, once they have it, they can trickle it down to the federal government, national, and the federal government can trickle it down to state governments, and also work in collaborative workshop with private government. So we can begin to ask the need, like we can begin to talk about the things we need from our patients and begin to standardize them. I think we standardize information, we are good to go, because that's what digital health is about. So the part about training, as I mentioned earlier, part of the African Union digital health strategy is actually to have workers, from data scientists to epidemiologists, leveraging tech skills. So part of the way to align with that strategy is also to train more of the workforce to be tech oriented. Once they are tech oriented, because I mean it's difficult. Like someone dropped in the chat how sometimes there's no trust. Now imagine when it is a doctor that is a seasoned professional that is actually trained in tech. It allows for easier conversation and conviction. And there's something I noticed earlier this year where there's a body called HFN. They organized the seminar. And they spoke about some things about getting import waivers and our import waivers for some products. I was shocked that 6 months down the line, they announced it on TV. So it means to align to that digital strategy, African Union digital strategy, there needs to be a lot of workshops, like a lot of collaborative workshop, lot of
Yeah.
healthcare professionals coming together discussing what they can get from each other. And I mean, the Data Privacy Act was passed into law, I think, when the president came into power. So those things, it means everybody should be concerned about it, such that they are already building governance around, their data um, collection, quality of data, data privacy, and also standardizing interoperability of EMR records. I think once we have those information, we can now go to the broader table, to West Africa, Sub-Saharan Africa. I think they call it West African Health Organization. Wow, we can go there, have a broader conversation with them. From there, we trickle it down to the African, region, and from there we even connect to the world, such that um, when we also now begin to interface with people like GIDH, I think that's a newly formed directorate in WHO. Whatever they're asking of you, you already have your information. You already have, the small details, the fine details, and they will tell you what you need to fine tune. And because you're already investing in these assets, you can easily tweak and, fitting into the WHO, the African Union, and even the West African Health Organization. So I think that's what how we can align with the digital health strategy for African Union and other bodies.
Thank you. Thank you. Wide dissemination, where people are, is definitely very important. We cannot assume that these continental strategies are well known by everybody. Thank you for that. Dr. Uche, let's go back to the issue of equity. How can PPPs drive the development and adoption of telemedicine and remote care services, especially in regions with limited healthcare access? And as you answer, can you think of actual examples that you can tell us, initiatives that have been successful in reaching the unreached, or initiatives that have been successful in urban areas that can be that are replicatable in rural areas? Over to you, Dr. Uche.
Thank you very much. So I remember in 2020, um, during COVID, I set up a team and we developed a solution that was basically to okay. So then myself and my team, we had some understanding with flying doctors who were managing a particular what's that stuff called again? Is it quarantine? What's that? What did you call that location again?
The isolation centers?
Isolation center. Thank you. All right, we're managing isolation center. So and then we developed a software, a digital platform that could help. It's just 8 questions. Answer 8 questions. You get an automated response that advises you to isolate, or advises you to report yourself to an isolation center, get quarantined, and all that. All right. So, and that was like, I mean, it was just a simple cloud-based solution that helped a whole lot at that time. And then we developed it to become a telemedicine application, and it was Talk to Doctor. We called it Talk to Doctor then, and I got it from, the name just came out from how it works in my house, in my family. Anyone who is ill, older ones, have you talked to Chime? Have you talked to Chime? And then we developed something called Talk to Doctor. Interestingly, the challenge was basically to get healthcare professionals on the platform, because now it was solving accessibility, but would it solve affordability? We went on to made it geolocation sensitive. So we were even onboarding pharmacies, onboarding diagnostic center, and all that, so that wherever you are, lab and diagnostic center, so wherever you are, 50 meters to wherever you don't need to leave your home to any health center. You could see a doctor while in your house. within your location there. You go to the closest lab center, they run a test, go to the closest pharmacy, and all that. Somewhere down the line, we stopped it because we were not having enough professionals, and we tell
Yeah.
them stay online. And even when you do this kind of Uber Bolt arrangement where you assign a patient to a doctor that's online, you never get many of them online. So it was a huge challenge. All right, but I'm so happy for those who are successfully implementing. My friend and classmate Becky runs a Mobi Health in Nigeria here, and they're doing quite well. I also know that the guys in Kenya, what's their name
Yeah.
now? I also know they are doing quite well. There's also Zipline
Yes, the zip line here.
in Ghana. Oh, there's Zipline in Kenya too.
Yes, there is.
Oh, fantastic! There's Zipline in Kenya. There is it
There's
Baby?
zipline in Nigeria too.
Oh, Zipline has come to Nigeria. Fantastic. There's MT Bar in Kenya. You
Yes.
know, even Life Bank. Life Bank is in Nigeria is an amazing thing. They're ensuring blood access to blood or blood constituents is accessible easily. Chima here has talked about drug stock. Drug stock is doing also amazingly well, ensuring that access to medicines is also well democratized. There's Wella Health also. There's Visita in Egypt. I mean, these guys are doing well in
Yeah.
telemedicine. So go back to your first question. Can you take that question again, please? Your first question before this follow-up one.
It was about how PPPs can drive development and adoption of telemedicine and remote care services in
Okay.
regions with limited healthcare access. And then you mentioned a few examples of what is making that possible.
Yeah,
Yeah.
yeah. So BBB can bridge infrastructural gaps. All right, just
Yeah.
like Chima said, that government has to create an open environment. All right. So
Yeah.
and Dr. Osas talked about facilities that are underutilized. Let government ensure that these facilities are, let's have broadband infrastructure in these facilities. Government has Nigerian Communications, has NIDA, has everything. All right. So that we can run those facilities with telemedicine. All right, we can have the nurses sign as chaperone. So these people come there. I was even involved in deployment of some telemedicine solutions in three strategic teaching hospitals, one in North Central, Southeast, and the other I think is Southwest. Okay, and Southwest. All right, and it was a whole telemedicine institute. So these they should be able to. The idea was that they should be able to be serve as support for primary healthcare facilities in that state. All right,
Yeah.
and in other states. But again, government is what it is. All right,
Yes.
I'm hoping that the private sectors, private sector comes in to invest in telemedicine platforms. For example, if I hope I'm not advertising, but I hope I'm allowed to mention names. I don't know. There are two.
Go
Okay,
ahead.
okay. There's MTN and Airtel, yeah, in Nigeria, and they're also aiding telemedicine platforms. I remember a telemedicine, um, a telemedicine, a telehealth initiative was launched in Abia State, Nigeria in 2018. Globacom provided phone lines that were, that allowed people to do, is it free calls now directly? So when you call, you don't get billed, all right? Doctors were on one end. That was an amazing telehealth initiative, all right? So
Yes.
people toll free, yeah, that's the word, toll free. So people can, if you need to talk to a doctor, you call toll free, and then when they administer care, but of course it's under, you would have paid, all right? You'd have subscribed to that platform. So every time you call that number, it's free. So you can talk up to 30 minutes at very affordable rates, So yeah, so that's one. And of course, as this is, since funding is a major barrier in healthcare delivery across Nigeria, people can allow pooling of resources to overcome this challenge. I just shared what we're doing with it. I shared what we're doing with the community in Abia State through the Community Development Association. All right, they say, hey, through doctoral healthcare, come and provide care for our senior citizens. All All right.
Mm.
If not for them, they're like 500. Give us, design a package for them, and we say, you know what? Let's come and do a research. Let's find out. Let's have basic ideas what the common ailments are, so it can help us tailor a
Yeah.
solution suitable for them. So that's another thing. Now the community is coming together, pulling funds together, and ensuring that happens. So it's not just taking care of the indigents alone; it's ensuring that care cuts across board, whether indigent or do you understand? All
Yeah.
right. So again, joint awareness campaigns. All right.
Yeah.
Public get educated about telemedicine benefit. Government should ensure. All right. I shared about that telehealth initiative in Abia State. All right. The government took time to enlighten our people, the state government. So I totally agree with Dr. Sars when she says state government um, have better understanding and allow deployment of PVP than even than federal. All right. At some point in time, I was coordinator of the network in Nigeria called the Tertiary Healthcare Network. We had 54 CMDs of federal government in hospitals in that network. We designed it an EMRO that so it can help all of them run in the network. They can data can sync easily. There can be easy push and pull of data across teaching hospitals. Guess
Yeah.
what? I think network was formed in 2013, 14. Till yet, we were not even successful. We won at federal level. All right. But we tried to do it among public
Sorry to
network hospital owners. It works. In 3 months, we are deployed. All right. So
Yeah.
if government helps in joint awareness campaigns, talk to her people, community engagement, like I earlier highlighted, it will help improve trust and adoption. All right.
Yeah.
And again, getting knowledge from the telehealth initiative I talked about, it helps scale workforce capacity. All right.
Yeah.
Now,
Yeah.
medicine relies on trained personnel to deliver quality care. So yeah, so doctors are at one end. All right,
Yeah.
nurses are one, and we talked about allied health professionals. And I'm happy we had that conversation. And here's what I let me just try and answer that. The problem, the tension is actually from us, the professionals. Chicken, and there's no policy from an outsider. We are the ones that form the policy, and now
Yeah.
it's clear with the migration in Nigeria we call it Japa. Doctors have left. These are living in drums in thousands, and the healthcare system is suffering. So these allied healthcare practitioners can now come into play. All right. I mean, you can have a lab technician who knows how to who can take samples very well. All right,
Yeah.
and get the medical lab scientists on the other end to interpret this person's findings, the lab technician's findings. So, and of
Yeah.
course, right, there could also be leveraging health data for policy and innovation. Government can set up data protection frameworks and use collected data to guide healthcare policies. This is endless, all right?
Yeah.
And this can also create sustainable micro-insurance models, all right? Like I tell them, see, if the health insurance at state level isn't working, let us start the community. Let's set up the community insurance scheme. All right.
Yeah.
Let's build trust from there. All right. And then go into state and then
So I'm sorry to interrupt. We're running out of time for this session. If you could please just
okay.
wrap it up, we'll get some
All
final
right.
input from the
All right.
panelists.
Yeah, I'm done. I'm done. I'm done. Thank you.
Thank you.
So we have about 7 minutes. I want to just bring to the fore some important questions that have been raised. But to anybody who's answering, just take a minute or a minute and a half to answer. I think it's important we discuss security. Hassan Garba has said, how can we ensure security? Data breaches are so common in health records. And also, Peter has raised the issue of trust, that people don't usually trust the government partner in the PPP in terms of handling the resources assigned to them in the digital health infrastructure. So I don't know who would want to take up the security question in just 1 minute, and who will take the trust question.
Hello, can you hear me?
Yes, Chima.
So for security, security speaks to data privacy, right?
Mhm.
Yeah.
Yeah. So, I mean, this word is not new. It's borrowed from corporate governance and the rest. So for every company that deals with every healthcare company that deals with patient and patient data, and stores in the cloud, can retrieve, can share, that company has to, I think it's part of the requirement from NITDA when you are registering your company to have your data governance, like
Mm.
what's your data strategy, what's your data governance. And when you look at the features of that data governance, I mean, there should be a lawyer, there should be an experienced cybersecurity professional. I mean, we
Mhm.
have them. I think recently they announced the first professor of cybersecurity in Mivan University. So we're already building talent in that area. And I, with two or three other people, I think once it's compulsory that that's part of the things you must present before you get your license to operate from
Yes.
NIDA. I think we can start to, address the
Yes.
security, data security. That's the best we can do from there. And maybe from there other
Mhm.
things may come up. But the first thing is your
Yes.
data strategy, your data governance, and
Yes.
before you get your license, you have to present that
Build
to.
it into the
Yeah.
regulation.
Yes.
Anybody wants to address the issue of trust? Because any PPP will rise and fall on the currency of trust in just 1 minute before we close. People say we cannot
It's
trust
simple. Yeah, it's simple. I'll take this off from Dr. Shah's last comment. Government should government should be open to professionals in private sector. And on the private sector also, they should know that, hey, we understand this system. You can't throw in 10 naira today and get 20 naira tomorrow from healthcare. All right.
Yes.
Your return on investment, spread it. All right. So it doesn't look cumbersome for government to understand. Thank you.
Thank you. Participants, let's appreciate our panelists for giving us such great insights. If you can give a digital clap, please do so. This afternoon, they have focused on the role of PPPs. And what we have got is that PPPs must be patient centric, they must have sustainability built in, there must be a clear vision by both the public and the private partner, they must be culture sensitive, they must have equity also built in, and government must provide an enabling environment of the macro factors such as connectivity and electricity. Innovative financing models have to be thought for so that we can ease the cost of this digital health infrastructure on particularly on public sector. We can have a phased approach to address these costs. We can have flexible payment systems. The government partners must be forced to create a business focus or a plan to show how these resources will be used and paid for. And we need to align with broader national and regional strategies. We need to disseminate our initiatives widely to the public, and we must make sure that regulation both protect patients, like protecting patients' data, but also is enabling to the innovations that we need for our digital health infrastructure. Allow me to end it there and really thank you very much to our distinguished panelists. I think we need to close this panel. We'll see you at the next session in this conference. Thank you.
Thank you so much.
Thank you so much, Daniela. That was great, an incredible session. Thank you for your moderation. Thank you to all of our panelists. We learned so many incredible things from you today on public-private partnerships, the opportunities, the challenges, and all the advancements that are happening in the industry. So thank you once again. And to all of our participants, thank you for being here today, and for everyone watching on our live streams on LinkedIn and YouTube as well. So next up, we have a case study presentation titled Advancing Healthcare Financing in Africa Through Digital Innovation and Research. So these insights will be provided by Mara Frank from Germany. She's the Chief Impact and Growth Officer at Doctors from Madagascar. So to join this case study session with Mara Frank, please leave this current session and go back to the conference site. On the conference site, you go to the agenda at the top menu of the site, click on the live tab to see the session that's currently running, and then finally click on the join button on the right of the next session. A banner would be displayed to guide you now. So see you in the next session. It promises to be very interesting. Thank you. Bye.